How to appeal a Medicare prior authorization denial. If you have received a denial for a Medicare prior authorization request, you might feel frustrated. But do not worry, you have the right to appeal this decision. Let's walk through the steps you need to take to potentially overturn that denial. First, it is essential to carefully read the denial notice or your Medicare summary notice. This document explains why your prior authorization was denied and includes instructions for filing an appeal. You typically have between 60 to 120 days from the date of the denial notice to submit your appeal. The exact time frame depends on your type of Medicare coverage. For those with original Medicare, the appeal process consists of 5 levels. The first level is called Redetermination. Here, the Medicare administrative contractor will review your appeal. You will need to submit a written request for this review. Usually, you can do this by filling out a specific form or following the instructions on your denial notice. Make sure to include your name, Medicare number, and a clear explanation of why you disagree with the denial. Adding any supporting documents from your healthcare provider can strengthen your case. If the redetermination decision is not in your favor, you can move on to level 2, which is called reconsideration. This step involves an independent review by a qualified independent contractor. If you still do not receive a favorable outcome, you can request a hearing before an administrative law judge at the Office of Medicare Hearings and Appeals. This is level 3 of the appeal process. Should the judge's decision not be what you hoped for, you can proceed to level 4. This involves requesting a review by the Medicare Appeals Council. Finally, if you disagree with the Appeals Council's decision, you can take it to level 5, which is judicial review. This means filing a lawsuit in a federal district court. For those enrolled in Medicare Advantage plans or Medicare Part D drug plans, the appeal process is similar but managed by your specific plan. You must file your appeal within 60 days of receiving the denial notice. You can request either a pre-service appeal if the service has not yet been provided, or a post-service appeal if you have already received the service. Your plan should provide written instructions on how to appeal. To strengthen your appeal, consider obtaining a detailed letter from your healthcare provider. This letter should explain why the service or item is medically necessary. Including relevant medical records or test results can also be beneficial. Clearly state why you believe the denial was incorrect and keep copies of all documents you submit. If needed, you may want to appoint a representative to assist you through the appeal process. Remember, many Medicare appeals result in a full or partial overturn of the initial denial. So, pursuing an appeal can be worthwhile when you believe coverage should be granted. Timely filing and following the instructions carefully are key to maintaining your appeal rights.